Hello, this presentation is going to be covering the project for the Doctorate of Nursing practice for the Finance Final. Discovering active and latent conditions using in situ obstetric hemorrhage simulation. The problem is that in obstetrics, hemorrhage continues to be a major cause of maternal morbidity and mortality. And even though we've have evidence-based interventions and they've made a concerted effort to standardize care, there continues to be maternal death and maternal morbidity in obstetrics. Part of our challenge is to discover innovative ways to reduce the risk. And in our complex dynamic healthcare environment, this not only has to be done, but done on a regular basis because there's so many changes that are going on around us every day. So there is a lack of proactive risk assessment on units for high-risk, low-volume events such as hemorrhage. We tend to do root cause analysis after there's harm or after there's an event, but we need to be more proactive and discover our risk points before these happen. Care is human and we will make mistakes, but trying to develop the best systems around our care is going to help mitigate that risk. So the model we used is Reason's model of Swiss cheese, in that there is holes in the institution, the organization, our profession, team dynamics, individuals, and then there's technical skills. And what happens is if we have the perfect storm and the perfect alignment of these risk points, it may cause undue harm to our patients. So the project is designed using unit-based in situ hemorrhage simulation. We need to discover active threats and potentially latent threats and individualize these plans to fix things on the unit through systems and processes to mitigate the risk. And our risk management and patient safety departments are very interested in this. There's constant change on the units, constant challenges, and we have to have very creative solutions before a catastrophic event can occur. And using the hospital environment to assess these vulnerabilities and weaknesses is best practice to enact meaningful change. So the strengths, weaknesses, opportunities, and threats. The strength of this program is it can potentially decrease our legal exposure, which that also is a monetary goal. It can increase patient safety and increase our outcomes. There's really great administrative and internal risk support and clinical support for this project because it is simple and it is very meaningful. And it fulfills the Joint Commission requirement for an annual proactive risk assessment for the hospital. It's really great too, our opportunities, there's minimal financial impact because this is going to occur during our normal annual skills day and competency assessments, so we were already paying the staff to do these drills. And of course it's going to identify the problems before they reach the patient, which is very important. And it includes a frontline staff in the solutions for the unit, which is very empowering, and it helps them be engaged and also to embrace the changes that are coming forth from this analysis. The weaknesses are, of course, not all threats will present at any given drill, and the variety of team members can impact the discovery, the team dynamics. We found that there's always a difficult time getting the physicians to make it very interdisciplinary and as real as could be. So that is also a weakness. And then follow through necessary to take information and develop the plan. It's easy to develop the plan, but there's the potential that we won't follow through on all the items that we identified that are threats. And so going to the threats, sometimes there is a lack of vision regarding the risk and competing priorities. If it's not happening right then and there, we tend to minimize the risk. Very good at addressing things when there is harm already happens, but not to be proactive. The participants also during the drill may not embrace the importance of their role and not fully participate in the drill. And again, that's not going to help us fully discover all the risks that are involved and to make suggestions for improvement if they were to have that same hemorrhage happen to them the next time. So again, we're going to use in situ simulation in the labor and delivery unit. It's very important that it happens in the unit and not in some sim lab or something like that, because we want them to discover the risks that are in that unit and make unique changes that are meaningful to them and meaningful to their patient population, using their equipment and using the processes that are in place in the hospital. And during this time also, patient safety is not compromised because it's a drill, it's a simulation, and we're going to be learning from our mistakes and correcting them and correcting system and process errors. There's no additional cost to the hospital because these drills, again, are already part of our training budget for the nurses. As I was conducting the literature review, there is a lot of literature on simulation and in situ simulation. There is literature about identifying active and latent threats, but there's not literature on combining all these things as a means for risk and quality improvement. There definitely is no studies solely using obstetric hemorrhage as the content for these drills. So this project is unique in that way. It does combine many different aspects of care and many different types of literature combined into one. So hopefully we will have new literature to review. So the project participants, audience, and stakeholders, obviously the labor and delivery nurses are the most impacted by these changes that will happen and the participation in these drills and the discoveries of latent and active threats. And also OB and anesthesia providers, because it's their patients and they're also practicing with us on the unit. The patients, obviously. Risk management, administration, because the less risk we have, the better patient outcomes, the better satisfaction, the better it is for the hospital, and also our legal department, because it averts lawsuits, and also the potential for paying out money in claims is going to be decreased if there is less threats and less harm caused to our patients. So the project design, we took the model of simulation from the neonatal resuscitation program, which is American Heart and American Academy of Pediatrics, and they have a very good simulation and debriefing program. So we use that as the model for the simulation and the debriefing. We used the scenarios that were evidence-based and tested by the California Maternal Quality Hemorrhage Collaborative. And then our data collection tools we used from the California Maternal Quality Care Collaborative and Team Steps. So the CMQCC was for the technical skills, such as did they perform certain tasks. And then the Team Steps we used for non-technical skills, which was things like communication, teamwork, and team dynamics. And then we also use the medical debriefing guide to help guide the debriefing at the end to capture all of the input from the participants. So it was a descriptive design. We gathered qualitative data. The project was conducted, or isn't done, but the drills have been completed over a 2-month period of time, and we're in the process of categorizing and recording all of the data from the drills about the active and latent threats. And also what came out of this was potential solutions to these problems, not just identifying the problem, but the staff actually took that extra step in identifying potential solutions to the problem. And then that will be presented and compiled and completed in January, and it will be presented to the administration, risk, and management staff. So we're also going to present this to the OB and anesthesia committees because we want their input about what they think meaningful solutions would be to these problems, and also to get buy-in potentially for next time when we do this, that they would be a more active participant in the problem. And although it's beyond the scope of what this project is evaluating, the desired outcome measure would obviously be decreased morbidity and mortality, improve patient outcomes. So in summary, hospitals are complex, risky environments, and healthcare leaders have to identify and mitigate risk to improve patient outcomes. And this needs to be done proactively, not reactively. In situ simulation can be used to discover these threats and mitigate that risk before there is patient harm. And of course, an individualized risk reduction plan can be implemented on a institution-specific weaknesses, that we find during that simulation. This is the poster, that one shot of what you could present to go over the project, the abstract, the problem design methods, the expected outcomes. And we use this also to present to our OB committees and our quality, risk, and administration. And then here are the reference slides. Thank you very much.